The virus is spread through saliva, mucus droplets from sneezing and coughing, and sometimes tears. If you have mono, you can avoid passing the virus to others by not kissing anyone and by not sharing things like drinking glasses, water bottles, eating utensils, or toothbrushes. You should make sure to sneeze and cough into tissues and then discard them, and to wash your hands frequently with soap. The good news about mono is that it's less contagious than the common cold. Your immune response is usually sufficient in fighting off the infection. No medications are needed. However, it can take weeks or even months to feel normal again. Here's what you can do to help your body fight off the virus. First, get plenty of rest. This is the key to recovery. You may need to bed rest, which could keep you away from school or work for a little while. Second, drink plenty of fluids to avoid dehydration. To soothe your sore throat, you can gargle with salt water or use throat lozenges. If you have a fever and headache, take acetaminophen, such as Tylenol, or ibuprofen, such as Advil. Avoid contact sports, rigorous activities, and heavy lifting. Your spleen may be enlarged, and impact or straining could cause it to burst. Your spleen is an organ that filters your blood and supports your immune system. A ruptured spleen could lead to internal bleeding and serious complications. However, spleen rupture is quite rare and is easily avoided if you ease back into physical activity gradually after your symptoms have subsided. Do not use antibiotics if you do not have a bacterial infection. Mono is caused by a virus, which is not killed by antibiotics. Your doctor should only prescribe an antibiotic if you have a superimposed bacterial infection, such as an ear infection or strep throat. In severe cases of swelling of the throat, tonsils, or spleen, your doctor may prescribe the use of corticosteroids that reduce inflammation. Some symptoms can be relieved by taking anti-inflammatories and medications to treat pain and fever. However, they do not treat the cause of the illness. Medications mentioned treat the symptoms, not the cause. Remember that the number one thing you can do to treat the cause is to rest and let your body fight off the virus. Your symptoms will disappear within a few weeks. However, your body will not fully rid itself of the virus. It actually stays with you forever, but in a dormant state. When the Epstein-Barr virus infects your cells, it goes through two different life cycles: the lytic, or active cycle, and the lysogenic, or resting cycle. In the lytic cycle, the virus infects your cells and takes control of their DNA. The virus then uses your cell's materials to make copies of itself so that it can infect more of your cells. In this cycle, the host cells die and you experience flu symptoms. During the lysogenic cycle, the virus stops making copies of itself. Its genetic material hangs out in your cells and replicates with your own DNA when your cells decide to divide and make daughter cells. In the lysogenic cycle, the virus does not kill your cells and does not make you sick. It's possible for the Epstein-Barr virus to switch back into the lytic life cycle, but it will not cause any flu symptoms because your immune system is prepared. Your immune cells have seen the virus before and they know how to fight it off. However, when the virus is in the lytic cycle, it's active and can spread to other cells and to other people. You can prevent mono by keeping your immune system in good shape to fight off the viral infection. You can achieve this by maintaining overall good health by adopting a healthy lifestyle. Make sure to eat healthily and sensibly, exercise regularly, and sleep adequately.